Hi there, I'm Dr. Jim Collins. My topic today is a really fascinating one that I'm doing more research on. I'm going to be presenting a 3-hour seminar on this topic, and it's something that people have been asking for. Artificial intelligence in healthcare. Really cool topic, right? The robots are coming to a hospital near you. Actually, you know what? They're probably already there. And they have been for a while in plain sight without many people actually knowing about it. As a matter of fact, healthcare is the perfect fit for artificial intelligence in a number of ways that I'm going to talk about. There are other industries, though, outside of healthcare that have been using artificial intelligence for some time now, including the internet, manufacturing, financing and banking, and the automobile industry, and the smart mobile device market, cell phone. Artificial intelligence seems to be absolutely everywhere, especially where there are excessively mundane tasks that have to be performed by humans who just absolutely get tired of doing the same thing over and over and over and over. Automate. So what is artificial intelligence? Wow, I got online and I ordered a bunch of books and I really learned a lot about artificial intelligence that I knew nothing about. Most of it is way over my head, way over my head. But let me tell you what I've learned. Artificial intelligence, or AI for short, is a field of science that studies and develops intelligent machines. It encompasses codes or algorithms that are designed to imitate human intelligence or behavior. Some common examples are self-driving cars. Do you have a self-driving car? Would you buy a self-driving car? Would you get into a self-driving car? I have a friend and colleague who has a self-driving car and drives from one city to the other, about 2 hours away, straight shot on the freeway. And he actually works on his computer and makes phone calls and writes notes and doesn't look up very often. I don't know if I'm going to do that. Aerial surveillance drones, another example. GPS and Apple's Siri. It also includes applications that predict weather patterns, monitor and trade stocks, and of course, the good old-fashioned Google search. Those are all examples of artificial intelligence. AI involves machine learning and deep learning. And then this is where I started to go, okay, I have to sit down, take notes, highlight stuff, and really wrap my head around this. Machine learning is a subdomain of artificial intelligence that involves techniques and processes which assists machines in becoming smarter and more able to develop their own logic. Deep learning, on the other hand, is a very specific kind of machine learning that uses artificial neural networks, which are meant to mimic the biological structure of the human brain. Are you terrified yet? So how is AI used in healthcare? Many experts agree that artificial intelligence will bring a complete paradigm shift to almost every aspect of healthcare and medicine as we know it. While some people fear that AI will one day replace human physicians and nurses, it is really not meant to. Rather, the goal of AI is to help and assist medical professionals catch problems long before they arise. AI helps doctors to see things that they cannot see with the human eye. It also allows them to use technology to do things that they couldn't do. AI provides a steadier hand than the human hand. It is meant to be used and guided by the doctor, not to replace the doctor. AI can also help lots of other healthcare professionals too, including radiologists, surgeons, psychiatrists, anesthesiologists, pharmacists, dermatologists, dentists, and ophthalmologists. Healthcare and medicine seem to be unlimited spaces that AI can fill with new and fascinating improvements. AI can actually teach doctors, help them with decision making, testing, diagnostics, and care management. And I could go on and on and on and on, but I encourage you, if you're interested in this stuff, it's the future. If you care about the future of medicine and healthcare and the use of technology, AI is something you need to look into. You're a healthcare professional, you're on this side of the fence right now. One day you and I are going to be the patient, and AI might be used to treat us. So, I'm Dr. Jim. Check out artificial intelligence in medicine and healthcare. See you soon.